This week in Health and Science News, a new study finds that a common blood test for ovarian cancer may miss some Black and Native American patients, which can delay their treatment. This new study looked at a test called CA-125. The test measures a tumor marker in the blood that doctors use to determine if a woman with a suspicious lump should be referred to a cancer specialist. Black and Native American patients were 23% less likely to have an elevated CA-125 level at ovarian cancer diagnosis compared to white patients, which suggests that the current thresholds are just set way too high. The Trump administration is shuttering the Health and Human Services Long COVID office as part of its reorganization. Patient advocates and patients with long COVID, like myself, are furious at this decision as it seems to go against what HHS Secretary RFK Jr. said during his confirmation hearings, that he was going to focus on chronic disease. Long COVID is a chronic disease. In interesting science news, a t-shirt that monitors vital signs after surgery lets patients leave the hospital sooner. These t-shirts are kind of like watch wearables, but they give a lot more data, like electrolytes, stuff that they need to continue to monitor after bladder surgery that can reveal like mineral imbalances that could lead to serious complications. The t-shirts also detected the onset of cardiological conditions in 5 patients, which allowed for early diagnosis and treatment. It's a very interesting addition to possibly recovering from surgery at home while also being monitored. In disheartening news, the U.S. is pulling back $12 billion in funding to state health departments, which also trickle down to local health departments. This funding cut affects infectious disease and mental health programs, which comes at a pretty terrible time considering that we're having the worst measles outbreak that we've had in decades. The Centers for Disease Control was rocked last week when 5 high-level CDC officials left the agency. These departures were deemed retirements and were not announced publicly. And last up, an Australian man in his 40s is the first man to survive with a titanium heart for 100 days. He lived with a mechanical heart for 3 months while he was awaiting a heart transplant, which he was able to get. This success will help researchers understand how people cope with utilizing this device in the real world. That's it for this week. See you next week.